I'm Dr. Amber, and for those of you who don't know me, I'm a small animal rehabilitation vet. I specialize in rehab and advanced aging and aging healthy in our pets. One of the questions I get asked every day is, what food should I be feeding my pet? And it's a loaded question because there is no right food for every dog. The things that come into making a decision on what is right for our pet is a couple. One is, does our dog like it? Does our dog want to eat it? If our dog likes it and wants to eat it, that's already a big star. Do they do well on it? Do they lose weight? Do they gain weight? Do they have an upset tummy? Are they really gassy? Because if they're losing weight, gaining weight, or gassy, the food might not be settling quite well. And then another factor that comes in is sustainability, right? So even if they love the food and you love the food, but you can't stay consistent with that diet, that's probably not the right diet. It doesn't necessarily matter if it's kibble, raw, or fresh. It matters that your dog likes it, it settles well, it's sustainable, and your pet enjoys your food. Now, there are controversies and personal opinions everywhere. What I would like to say is advocate for your pet. This is Sunny. She came to work today. She has a diet. Her diet is a kibble-based diet because that's what she picks. We try other ones. She likes her kibble. It is one that settles well for her. She doesn't gain weight. She doesn't have an upset stomach. She doesn't vomit, and she's not gassy. So this is the food she stays on, at least for right now. If things change in the future, we can reassess. I also have a 14-year-old small breed dog with joint disease and early senility. She is on a different diet that supports her needs. My keys for you guys would be to pick a company you trust, a brand you trust, and find something that your dog enjoys that you don't have to topper, you don't have to convince them to eat. Now, every diet, whether it is raw, fresh, kibble, should be complete and balanced. And each bag should have an AFCO rating on the side that tells you it's been evaluated by another party that says it's a complete and balanced diet. If you're not hitting complete and balanced, then we should also reassess your food. Food is your fifth vital sign. It's the basis of how most of our body runs. So if you can't find a diet that you like, that your dog does well on, this is again one where I would reach out to your veterinarian. There are some myths that we don't learn nutrition. We have multiple semesters of nutrition. We have it from the cellular level up. We don't have brand that we pick because we have any alliance to. I pick brands that are best for my dogs. Here at this clinic, we know pretty much all the fresh food, raw food, freeze-dry food, kibble food, every variation thereof, because our patients are all individuals. So it is an important question you can ask your vet. Now, if you don't feel like you can trust recommendations because of personal opinions, then have that honest conversation without hesitation, right? So I do know that sometimes clients are afraid to tell me they're on raw food diets because they've been told in the past they're not safe, and they like the diet. The question is, what raw food diet on you're on? Is the pet doing well on it? And is it a complete and balanced, and is it as pathogen free as we can get, right? I don't mind if your pet is on it. I might have a conversation if they're immunosuppressed and have something like cancer, then maybe we have a conversation about the safest way to do that. So there is no perfect diet for all dogs, right? One note here, and I do want to toss this one out because sometimes there's some misunderstanding about the formulations of foods that are carried in veterinary offices. They're called therapeutic diets. So basically, if your dog graduates from typical food and now they need advanced nutrition care because of a disease, whether it's kidney disease, liver disease, gastric disease, cancer, therapeutic foods are used like a drug would be used. We try to reduce the overall medication need by putting them on a diet that supports the body from the inside out. And sometimes there's this look of, you're changing me to this therapeutic diet, it's a kibble, I don't trust it. And those are valid concerns. But again, having an honest, truthful conversation with why they're being recommended this food, because a lot of times I can manage a lot of diseases with a diet change, and I don't have to do so many meds and supplements. So Again, trust your vet, have honest conversations, and see where you guys land. But there is no perfect food for every dog. Each dog has their own perfect food. And if you can't find it, you should reach out and ask for help. Everybody have a great day. Say bye, Sunny.